welcome. We're so happy to have you with us today for our special webinar, Modern Families, Surrogacy and Fertility Options for LGBTQ plus Parents. My name is Kimberly House, and I'm the Intake Manager here at ACRC Global. I work closely with our amazing surrogates throughout their journey, and I'm thrilled to be hosting this session alongside today's expert speaker, Dr. Daneshmand. This webinar is designed specifically for LGBTQ plus intended parents who are exploring their path to parenthood through fertility treatment and surrogacy. Whether you're just beginning to gather information or you're already working with a clinic or agency, our goal is to provide helpful, inclusive guidance to support you every step of the way. We'll be covering topics like IVF advancements, the donor and surrogate matching process, and how clinics are working to support and celebrate diverse families. We want this to be informative, but also feel like a safe, welcoming space. So please feel free to ask questions anytime using the Q&A box at the bottom of your screen. We'll leave time at the end to answer as many of your questions as possible. Before we dive into the discussion, I also want to let you know that if today's webinar sparks questions or you feel ready to take the next step, we'd love to connect with you one-on-one. We offer complimentary consultations where you can speak directly with our team to learn more about the surrogacy process, ask specific questions about matching, timelines, and next steps, and see if we're the right fit for your journey. No pressure at all, just a chance to get personalized information and support. You can scan the QR code here to schedule a consultation or also find it on our website at acrcglobal.com. All right, thank you again for being here. Now let's get started. Now I'd love to introduce our guest speaker for today's webinar, Dr. Syed Daneshmand from San Diego Fertility Center. Dr. D is an internationally recognized fertility specialist with deep expertise in third-party reproduction and IVF. He's worked with thousands of intended parents, egg donors, and surrogates over the years and is especially passionate about supporting LGBTQ plus families through compassionate, science-driven care. He completed his training at UCLA, is board certified in both obstetrics and gynecology, can't talk today, and reproductive endocrinology, and has developed some of the most successful IVF protocols in use today, including the PTEC method, which has helped improve pregnancy outcomes for so many hopeful parents. He also serves on multiple surrogacy advocacy boards, has received numerous awards for both his research and clinical work, and brings a global perspective to his practice, speaking French, Spanish, and Farsi. We're truly honored to have him join us today, and I know you'll find his insight incredibly helpful, no matter where you are in your journey. Dr. Daneshmand, thank you so much for being here.
Thank you, Kimberly. It's great to be here among you and future parents. I mean, this is an exciting and thoughtful step in the journey to building your family. You know, as a father of 3 daughters, this is a journey of love. It's challenging. It's lots of work, but it's the what they call the toughest job you'll ever love. So it's wonderful to be here with you.
Yes, we're very excited. That's awesome. All right, now we're going to shift into our Q&A session where we'll dive into some of the most common questions we hear from intended parents exploring fertility and surrogacy. We'll cover topics like how to get started, what to expect during the IVF and matching process, and how clinics and agencies are supporting LGBTQ plus families every step of the way. Dr. D, let's go ahead and jump into our first question. Okay, what are the first medical steps intended parents should take when exploring surrogacy?
You know, I always think about the journey sort of in 3 steps. You know, you have the first step, which is the diagnostic testing, and then you have the IVF cycle, either with an egg donor or the patient's own eggs, and then you have the surrogate search and the match with a surrogate, and of course screening and leading up to the embryo transfer. So the first step is diagnostic testing. And for future parents, we want to assess their egg reserve. We want to assess the sperm quality, the sperm parameters. We want to do something called genetic recessive mutation screening, which means that we look and detect recessive mutations like thalassemia, cystic fibrosis. We look for 300 different recessive mutations to ensure genetic compatibility. So if intended parents are working with an egg donor, we want to make sure that the sperm provider and the egg provider don't carry the same recessive mutations, because then that could increase the likelihood of a particular genetic condition. And if they do, then we have options for testing the embryos. So really this first step is diagnostic testing, learning more about you, the sperm parameters, the egg parameters, before we move on and formulate a plan for the IVF cycle.
Wow, yeah. It's so interesting how you can do things like that. Just the science is incredible.
It is, and the great thing about today is that there are many, many options for diagnostic testing. There are actually companies out there that will send you these sort of test kits for genetic analysis, test kits for sperm analysis. So lots of options. You don't necessarily need to go to a lab. There are many companies now that will allow you to get testing done in the comfort of your own home. And then you just send us the test results so we can analyze and review and move to the next steps.
Oh, that's nice. Definitely the comfort of your home, when it's already something probably nerve-wracking. So that's
Exactly
awesome.
right. Exactly.
We're seeing more diverse families pursuing parenthood. What does that journey look like for same-sex couples or single parents at your clinic?
It's all about supporting future parents and their journeys. So the first step is having a consultation with our future parents, or for example, single intended parents. We have a consultation together. We go over their medical history, their family history, their genetic history, and then we go through the steps in the journey, because at every step, there is a layer of support, and we want them to understand every step, because if they're well informed, it really makes them empowered. And information and guidance and support is all about empowering future parents. So really, it starts off with a Zoom consultation. We have a chance to sort of connect together. We talk a little bit about their medical history. We talk about our clinic. We talk about the IVF cycle, the surrogate search, the screening of the egg provider or the egg donor, the screening of the surrogate. So it's really laying the foundation for future parents, sort of as they embark on their journey to creating their families.
No, yeah, that's nice. Like kind of walking them through each step and making sure they're really comfortable with like a big
Exactly
decision
right.
like this. That's
Yeah.
awesome. What are some of the most common misconceptions you hear about surrogacy and IVF?
That's a really good question. I think some of the misconceptions are sometimes related to timing, because all of this takes time in terms of finding your ideal egg donor, matching with the ideal surrogate. So I think sometimes intended parents may feel that the whole process can be done in a much shorter way, or a shorter manner, but it really takes time. This is a thoughtful journey. Each step requires vigilance, requires a great deal of meticulous attention to all the details. So I always tell intended parents, sort of expect the journey to take anywhere between 14 to 20 months, and that includes the 9 months of the pregnancy, because sometimes it may take longer for you to find your egg donor. It may take longer for you to find your surrogate. So I think that's one of the misconceptions. The other misconception is about just how much testing we can do on the embryos. Can we test for everything? Can we test for conditions like autism, Asperger's, diabetes, high blood pressure? So there are some limitations to the testing that we do on embryos. We can test for specific genetic mutations. We can test for chromosomal copy abnormalities like Down syndrome. And then there are a series of companies now that are offering something called PGTP, which is conditions, polygenic conditions. These are conditions, medical conditions, that have multiple factors, environmental factors, multiple genetic factors, but we're still in the early stages of that particular testing. And these tests need time to be validated, research to be done. So I think those are maybe two of the misconceptions that we sometimes run across when we're speaking with intended parents.
Yeah, I mean, that makes sense. I'm sure they're so excited, but like you said, it's stages, it's a process.
Exactly right. Exactly right.
How important is embryo screening or genetic testing in today's fertility practices?
I think genetic screening has become more and more important as the technology has improved. So now the technology has become better and better for doing analysis, detecting genetic disorders in the embryo. And it's not just about chromosomal copy abnormalities like Down syndrome, but sometimes we find genetic mutations when we do genetic testing on the sperm and the egg providers. these genetic mutations, even in single copy, can have potential effects and may increase the risk of certain conditions. So those particular mutations can be detected in the embryo. As we talked about, it's important to start off with the diagnostic testing, look at the genetic screen of the intended parents, and then from the genetic screen, we can outline a path and a plan to genetic testing of embryos. So it is important. Now, sometimes it's more important to do chromosomal copy testing on embryos. Why? Because the egg provider is older. As you know, women are born with all the eggs they're going to have throughout their lifetime. As they get older, both the number and the quality of the eggs decline. And so in the ovaries, if a patient is 35 and older, there's a higher probability of chromosomal copy disorders. So when we talk about how important is screening of the embryos for chromosomal copy abnormalities, it really has to do with the patient's history and the patient's age, her previous medical history. Has she had miscarriages, or have there been miscarriages with intended parents in their previous journeys? But we can tailor the genetic screening to the medical history and, of course, the medical diagnostic testing as well. It is really important. The other factor that's important is we want all future parents to have a consultation with our genetics counselor or with a genetics counselor. And the genetics counselor goes over the family history of the future parents. They go over the family history and the genetic screening of the egg provider or the egg donor. And then they can sort of formulate risks and discuss with intended parents the risks of genetic conditions as they embark on the IVF cycle. So it's really important to have this education piece to empower patients, because if you empower future parents, empower patients, they can make the best decisions possible.
Yeah, that's really cool. I had never heard of the genetic counselor, but that's really cool that they have somebody like that that, takes that time to make sure things,
Yes, and
that's cool.
they really play a critical role in the among the team members at a fertility center.
Yeah, I could imagine. That's awesome. Are there differences in how treatment is approached depending on the use of an egg donor, or I'm sorry, of an egg or sperm donor?
Well, I mean, the treatment is tailored towards the patient's history and the testing that we do. So when we're looking at an egg donor, for example, we're looking at ovarian reserve parameters. In other words, we're looking at her egg count, her egg quality, her height, her weight, her previous egg donation. So we want to review everything to tailor the best regimen, the best IVF regimen, and really have the best medication protocol to be able to retrieve the best quality eggs. The sperm donor is important because if intended parents are working with a sperm donor, it's important to know the sperm donor's genetic history, do the genetic analysis, look at the sperm parameters. Has the sperm donor helped conceive a child through previous donations? Psychological examination for all donors, egg donors and sperm donors. So there's a great deal of screening that's done on the egg donor and the sperm donor in order to ensure the health of the children that are born as with the help of egg donors and sperm donors.
Oh yeah, yeah, that makes sense. That's awesome. What should intended parents know about embryo transfer timing and success rates?
You think about embryo transfer timing, and the whole goal is to synchronize the embryo's developmental stage to the receptivity of the uterus. So what we're trying to do is to create a receptive uterus with the help of medications, estrogen, progesterone. And then there's this certain window of implantation, meaning at a certain time after using estrogen and then adding progesterone, or in natural cycles, there's a certain window of time where the uterus is receptive to the embryo. And that window of time is limited. It's not days, it's hours. So therefore, the timing of the embryo transfer is important and critical. We want to catch the uterus in that window of implantation. And then typically most embryos are frozen. We thaw the embryo at that particular time make sure the embryo is viable, looks good, and is developing to the next stage, and then we do the transfer. So the timing is important. And that's obviously done based on many research papers that have been published, including ours. I mean, I've been in practice now for about 27 years. We've published many papers in the field of IVF, looking at many different parameters, including endometrial or uterine receptivity. So we wrote a series of papers looking at when the uterus is receptive, how do we detect a uterus or determine when the uterus is receptive, and that is going to have an impact on success rates. So it's something good for intended parents to discuss with their physicians, what protocols are employed and how physicians and the clinic team is going to ensure the receptivity of the uterus.
That's crazy. Like I knew that, there was a timeline, but I didn't realize it was like literally hours that you had for a transfer.
Yeah,
That's
I mean, sometimes, those hours could be 12 hours, 24 hours, depending on the timing of the progesterone administration. But I mean, there's a window, and that window is not long, so we have to make sure we synchronize the embryo thaw and embryo transfer to the maximal receptivity of the uterus.
yeah, that's fascinating. It really is.
It's incredible science. Yeah, the
It
science
is.
is fascinating.
How have you seen the surrogacy and IVF experience evolve to better support LGBTQ plus intended parents?
For our LGBTQ plus intended parents, I think there are more options now. There's more guidance, there's more support. I feel that there are many advocacy groups advocating for their rights. I'll give you an example. Many of us here in California have advocated for IVF benefits, not just for heterosexual couples, but for all future parents, and specifically LGBTQ plus intended parents, because that's the right thing, that's the just thing. And so now there's a bill that has passed in California that hopefully starting into 2026 will provide some level of coverage for future parents, all future parents. So,
Awesome.
so I do think that the IVF experience and the surrogacy experience has evolved because now there are more advocates, more advocacy groups. There are more people speaking about surrogacy, speaking about egg donation, speaking about creating families for all, and
Right.
not excluding those who have been excluded over the course of many years. So we've been fighting this battle for many years. I mean, I remember the first gay couple who came to me. I think it was about maybe 24 or 25 years ago. And they happened to have a friend who was going to be their surrogate and an egg donor. And that was sort of the first journey that I was honored to accompany them on. And now their children they're well in their 20s. So but back then there were limited options. There were very few surrogacy agencies, very few egg donor agencies, very few clinics who opened their doors and welcomed the LGBTQ plus community to help them achieve their goals of parenthood. So I feel like we have come a long way, but we need to continue the fight to provide access and also make the journey more affordable. I think affordability is another component that needs to be addressed on a daily basis.
Oh yeah, I agree. I think that's awesome that they passed the bill, but we got to still keep moving forward with others.
Exactly right. Exactly right. I agree with you.
What requirements do you look for in a donor to determine if they're a good fit for intended parents?
You know, there are certain requirements that are important for all, genetic health, ovarian reserve, egg quality, psychological health, family history, looking at the family history of the egg donor to see if there's any particular genetic or medical conditions that could potentially affect or increase the likelihood of a medical condition in the children. And then the other factor that I talk to intended parents about is if intended parents are thinking about or envisioning a larger family meaning maybe more than two children, then not every egg donor is going to be suited for them because some egg donors will create a lower than average number of embryos. We expect about 4 to 5 good quality embryos to be generated from the donation of an egg donor in their 20s. But sometimes there are variations between egg donors. Some can help create 2 to 3 good quality embryos, some 6 to 8 to 10. So it's important to have that conversation with intended parents and to be able to give them an feedback on the egg donors and the number of eggs that we expect to be retrieved, the number of embryos we expect to be formed, so that they can reach their goal. Now, sometimes intended parents will choose a particular egg donor and say, well, we love this egg donor, we want to move forward with her. We know that maybe the number of eggs that she has is more limited or less than average, but we're willing to go forward with a second egg donation if need be. So again, it's that conversation that needs to be had. And again, it's all about empowering intended parents in their journey so they can make the best decision possible for themselves and their future family.
Right. Yeah. It seems like communication is a huge part of
Huge part,
everything.
Kimberly, and you touched upon it right just now. It's all about communication and support and guidance.
Right. Exactly. What are some important things intended parents should consider when choosing a donor or surrogate?
We talked about the donor in regards to the egg quality and egg numbers. The other factor is genetic compatibility. I mean, we do genetic screening on the intended fathers, on the sperm providers, making sure that they don't share any significant recessive mutations with the egg donor. So there has to be genetic compatibility with the egg donor. We talked about the number of eggs and the quality of the eggs and what the expectation is in terms of number of embryos that we help create. And then in terms of choosing your surrogate, when you're matched with a surrogate, it's important for you to be philosophically aligned with your surrogate. That's important. And this has to be a sort of this open, transparent discussion with your surrogate regarding many topics. And some of those topics are going to be sensitive topics, but they need to be discussed. So having philosophical alignment with your surrogate and sort of almost like being on the same page and having the same values and sort of the same vision of how the surrogacy journey is going to move forward from a medical perspective, from a communication perspective. What is the
Right.
expectation? How often do you want to communicate with your surrogate? Does the surrogate have the same expectation or is willing to have the same sort of desire for communication and being in touch with intended parents? So I think that all of that is important, and I think surrogacy agencies do a really good job to make the match as good as possible. But from, of course, a clinical perspective too, clinically the surrogate and the intended parents have to be aligned when it
Right.
comes to many different matters.
No, yeah, I agree with that exactly. Because yeah, as a surrogate, you're carrying this baby for someone else, but it's like it's their baby. What would they want? So
Yes,
definitely
yes.
agree with all of that. And yeah. What does collaboration between you and your team and agencies like ours look like to ensure everything runs smoothly?
It's all about communication. We have a terrific team here at San Diego Fertility Center, and we have different departments. For example, we have a department that initially reviews, collates, and reviews the medical records of the surrogate. So having that team have good communication and access to your team, to the agency's team that's sending us the medical records so that they can, have the conversations if need be, if we need more information, more medical records. So it's really having the team members in the clinic have access and good communication with the team members at the surrogacy agency. And that's what's going to make a smooth collaboration, and also having the same values and alignment in terms of how vigorous we are, how vigilant we are with every aspect of the surrogacy journey, making sure that the health of the surrogate is protected. That is a significant priority. The health of the pregnancy and future fetus and child are protected. So those are, if the values are similar between the fertility clinic and the surrogacy agency, that also makes for a great collaboration as well.
Yeah, definitely teamwork. Teamwork makes the
Exactly
dream work.
right. Exactly right.
What are some of the biggest concerns or anxieties intended parents express during the IVF process, and how do you help address those in your consultations?
I think one of the anxieties, or what significant anxieties that intended parents have, is over success rates. Are we going to be successful? Is this transfer going to be successful? What are the odds of success? The number of eggs that were retrieved, is that enough eggs? How are the embryos developing? Are they developing as they're supposed to? So, it's all about communicating and supporting intended parents on their journey. So as the IVF cycle is proceeding, giving intended parents feedback. How is the IVF cycle proceeding? Is it meeting our expectations? So it's communicating, giving intended parents support, guidance, giving them the information that they need to lower the anxiety. Because it's stressful going through IVF. How many embryos are created? Are these enough embryos for the family that we want? What are the success rates if we transfer this embryo to our surrogate? So I think there are anxieties over success. There's anxieties over choosing your egg donor, ultimately finding that ideal egg donor, matching with the ideal surrogate. But I think that providing support, information, and guidance to intended parents and being available to them so that you can communicate and say, we're here for you. We're going to help you find your ideal egg donor, match with your ideal surrogate. And of course, we'll make sure that we conduct vigilant screening so that we protect the health of the surrogate, of the egg donor, and the pregnancy and baby as well.
Yeah, definitely the communication support really is right
Absolutely.
there. Um, what advice do you have for intended parents on how to prepare for and handle unexpected medical issues such as screening results or embryo transfer outcomes?
I think educating yourself on the journey is a really good idea. There are many books out there. And here's a kind of a time that I can also plug a little bit our podcast. We have a podcast called Fertility with Dr. D, and it's an important podcast, as many others are as well, because we have episodes on the IVF cycle, embryo grading, surrogacy screening, egg donor screening. We speak to an egg donor. She talks about her experience matching with her intended parents and the screening that she went through. So you have to empower yourself. There's a certain level of responsibility that intended parents have in terms of educating and empowering themselves. And there are many, many tools out there. There are books, there are podcasts. We talked about our own podcasts about the different aspects. And if you educate yourself and empower yourself with the help of this information that's available, and make sure that the source of the information is reputable, then you are better positioned to ask the right questions when you speak to the clinic, when you speak to the physician, when you speak to the surrogacy agency. You can direct your questions more specifically, and then that will help you make the best decisions possible.
Yeah, it's nice that you have those other resources, for being a support, a book, your podcast. I think that's awesome. Just so you can kind of do it on your own time too, when you have time to lay in bed and think more,
Abs- Absolutely. I love it. I mean, sometimes I'm on a drive and I just listen to a podcast. It just educates me about different aspects of life. And I love that. I love that I can use that time to empower myself, educate myself about different aspects of life, health, economy, how to be the best parent, how to be the best father, best mother, best person, best version of
Right.
yourself. So I think that there's always room for growth, for education, and I think we all have to strive to continue to educate ourselves and to grow.
Oh yeah, definitely, definitely. Can you share a meaningful or a memorable story that illustrates the impact of surrogacy on growing families?
Yeah, I think that it's interesting because at one of the uh, on your introduction, you said Dr. D, speaks French, and I do speak French, and we have many intended parents from France and French-speaking countries, and in Belgium and in France and other countries. And it's interesting because many years ago, I was helping intended parents in Europe, and they were going through the surrogacy journey, and they had created the embryos. Unfortunately, there was only one embryo. We transferred the embryo to their wonderful surrogate, and the surrogate was pregnant, but unfortunately suffered a miscarriage. The intended parents didn't have any additional embryos. So they needed to create more embryos, and I think financially that was a significant burden to them. And so, I just my heart went out to them. And it happened that one of the intended parents was a professor teaching at a university, and they had translated books from French to English, English to French. And so I let them know that I would support them, and in the process, they would help me improve my French, and so that I can better communicate with French-speaking intended parents. And so they have 2 children, and I speak much better French now. So that was a wonderful moment in time when we as a team helped intended parents who were in a financial bind, and we didn't let them forget or give up on their dream of creating their family. So the other thing is that when you look at surrogates and you look at the relationship they have with intended parents, I see surrogates every day in the office. I speak to them every day, many surrogates every day. And when I see that incredible relationship that they have with their future parents, and the bond that's created, it's incredible. Just, this past week, we had several children come by the office, and there were surrogates within California, Southern California, who had helped these intended parents have their children. And the children ranged in age from 10-day-old newborn all the way to a 5-year-old. And each one of those intended parents were visiting us, and they were on a sort of a tour of the US. They were visiting us, and then they were going to spend several days with their surrogate at the surrogate's home. And I said to myself, wow, what an incredible bond. Whether it's the child is a newborn, or whether the child is, you had a child who was 5 years old, that bond that still exists, and it still is strong, that they're actually going to spend several days seeing their surrogate. And that's just because without surrogates, this journey is not possible. They are revered as they should be. And really, having worked with surrogates now for well over 25, 26 years, I have so much respect and gratitude for them. They putting their health on the line, their life on the line. They're sort of delaying their own potential plans, and to help someone have a family. Yes, they're compensated, no doubt about it, but there's a significant component from the heart, from sort of, it's almost like a combination of compensation, but a great deal of heart that goes into being a surrogate. So I think those are some of the moments that are precious to me when it comes to the impact of surrogacy on growing families.
Well, that gave me like goosebumps and emotional because, like had told you earlier, I'm a 2-time surrogate, and I had like those exact feelings when my family came in and they stayed for a month, and we got to see each other, and it just felt like a friend. You know what I mean? It didn't feel
Yes.
like a stranger. It felt someone you connected with, and it was amazing. You
It's
never
it,
forget it.
it's beautiful, and I have just so much admiration for what you've done, Kimberly, and you've
Thank
helped
you.
create families. And you're part of a very exclusive group of people who've been able to do that. First of all, you were an exclusive group of people because you were, from a health perspective and previous pregnancy perspective, you were able to do it. And then you made that decision to do it. That it takes courage, it takes dedication, commitment, that bond. And so that, yeah, I have a great deal of admiration for what you've done.
Thank you. And it's awesome everything you've done too, and everything you continue
Thank
to
you.
do in this field is amazing.
Yeah, no, it's wonderful teamwork.
Yes, exactly. What's the most important piece of advice you'd give to anyone just beginning their path to parenthood through surrogacy?
Choose a great team, a reputable, experienced team to help you, to guide you in your journey. There are lots of a great deal of information available to you. You can research, you can do your due diligence to find the team. And I think that's really important. Your clinic team, your IVF team, your surrogacy agency team, and your reproductive lawyer. If you have a great team surrounding you, supporting you, you will have support. You'll have a much higher probability of having a smooth journey, but you also will never feel like you're not supported in this incredible journey to becoming to building your families. So that's probably with one piece of advice I would have.
Yeah, absolutely. The support, definitely a big one.
Yes.
Okay, thank you again to everyone who joined us today, and a special thank you to Dr. D for being such a wonderful guest and resource. We hope today's webinar gave you helpful insights, answered some of your questions, and most importantly, reminded you that you're not alone on this journey. Our team is here to support you every step of the way.
Thank you so much for having me on. Thank you.
Thank you so much. And if you'd like to connect with us directly, ask follow-up questions, or schedule a consultation, our contact information is up on the screen now. On behalf of all of us here, thank you again, and we wish you all the very best on your path to parenthood. Take care and goodbye for now.